have been admitted to hospital with the Delta variant since last week. That's according to health officials, and now accounts for almost all of the UK's coronavirus cases. So says Public Health England. Some 33,000 cases of the variant were recorded in the last week, and Public Health England said the most recent data show 99% of all cases across the country are Delta variant. Well, that compares to last week, where it was 90% of cases. And if you compare that to the Alpha variant, which is our own variant from last winter, which led to that surge right here, ultimately, it led to that tougher lockdown at the start of the year. Well, compare it to the Alpha variant. The Alpha variant just made up of over 4,000 cases. So this really doesn't look good. All this while all new calls for testing in schools to be scrapped, with one professor saying it causes too much disruption to learning. Well, how likely is that to happen with the Delta variant spreading the way it is? Let's talk to Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. Really good to have you with us.
Good evening.
Good evening. How worried should we be about the Delta variant and the way it's spreading?
Well, we know it is very infectious, and it is now the dominant strain, the dominant variant in the United Kingdom, as is biologically expected. The unfortunate bit is we didn't shut our borders fast and early enough, and therefore we've got this surge. The number of cases would have inevitably happened, but we would have been in a better controlling position had we shut our doors earlier by putting India on the red list.
Really, do you think it would have made that much of a difference, given that the way how infectious it is? So if anybody came into the country with the Indian variant, it would have spread the same way, surely?
Yes, it would have made a difference. In other words, it would have slowed it down, because leading up to putting the brakes on India and quarantining people arriving from there was a surge in number of people who returned, and then the rest is history. So whilst we wouldn't have stopped it, we would have slowed it down a little bit by putting India onto the red list earlier, which we should have done.
So do you think this could make much difference to Freedom Day now on the 19th of July?
Yes, we keep on having these dates, and I personally feel the use of the word Freedom Day and irreversible, that bit really gnarls with me, because nothing is irreversible, because the narrative should be, depending on how things are, we will act accordingly to protect the population, rather than to say it is irreversible, because irreversible reads, I'm not going to put restrictions again. Whereas as a health protection person, I would say, to protect the population, I will do everything I have to do. So with respect to answering your question now, we are where we are, and what will save us is immunizing. So between now and 19th of July, if you manage to immunize as many people as you can, as fast as you can, then you have a large population that is protected. And if the data indicates that the vaccines are preventing people from becoming seriously ill, ending up in hospital and/or dying, then we can uncouple the link between cases and deaths, and then say to ourselves, immunization works, the immune population, green flag, start enjoying more of social activities.
So it all depends on the vaccination program, you're saying. That has still going well, but it has slightly slowed down. So if that continues at that pace, do you then think the 19th of July lifting of restrictions shouldn't happen? Or do you think it should happen, but potentially any changes could be reversed? What do you think? What are you saying?
So, Claudia, I would say that the current evidence indicates that the vaccines are working, and working very well, and they are preventing people from ending up in hospitals. There's always a lag time, but even with that lag time taken into account, my personal impression is that they are really working. So considering they're really working, meaning preventing people from getting severe illness and dying, then I'm optimistic, provided we now at greater pace immunize as many people as possible. Even a one dose starts to produce protection, and the two dose presents greater protection. So I personally think according to what we've seen thus far, that the vaccines will save the day, and we need to immunize as many as possible, as fast as possible.
So, yeah, looking at that data, then 99% of people who have coronavirus, have COVID-19, will have the Delta variant. If that continues, with more people being testing positive with COVID-19, more people being hospitalized with coronavirus, do you think it could potentially lead to a third lockdown? You're hearing talk of that potentially.
I don't think so. And my reasons for being optimistic are the vulnerable population in the UK, i.e. the elderly, the people with sensitive conditions like diabetes, high blood pressure, etc., have already been immunized. So that's good. We've now got a younger population who have also been immunized. And finally, we are immunizing anyone over the age of 18. So that puts the UK in a very, very good position. And therefore, I feel we won't have a third lockdown.
In terms of then the vaccine's effectiveness against this Delta variant, is it the second vaccine, the second jab? That's what we're focused on, isn't it? If people don't have that second jab, it's not as effective.
Yes. So the first jab, the first dose provides protection. The second dose accentuates the protection considerably. So with the 2 full doses of the vaccine, any vaccine, AstraZeneca, Pfizer, Moderna, you have maximum protection, and the maximum protection is in the order of over 75-80%. So the 2 doses considerably improve protection. Not everyone will ever be protected 100%, but 75, 80, 85% protection is very, very good. And that's what we need to have with the 2 doses.
So with the Delta variant spreading as it is, do you think maybe the lifting of restrictions that we're in now, do you think that could have been too soon?
It's tricky. And right now, if we were to lift restrictions, we don't know if the rise in number of cases equals a rise in number of hospitalizations. That we will know with the 3-week lag there always is with rising number of cases, and then 3 weeks later we know if that translates into hospitalizations. My personal view is it won't, and therefore I feel optimistic. But the proof of the pudding always is in watching it. So hence the delay in opening up. And with that delay, we do our homework. And the homework that we need to do is immunize as fast as possible. And I know what the issue is. We haven't got the vaccines. So the sooner we get them, the sooner we can immunize.
So what's your thoughts then on the scrapping of COVID testing at school? This is said by a professor who was a pioneer in the Oxford vaccine, saying that actually just drop it. Do you think that's the right move right now?
Well, we have in many respects been kidding ourselves that a test negative equals a green light, you are okay. A test negative can be wrong 40% of the times. So a test negative is almost meaningless. A test positive allows us to capture that positive infected person, pull them out of circulation, and pull their contacts out of circulation too. So testing has limited value. The value is when it captures the positive person. My personal view would be, I'm almost congruent with the professor that you mentioned, which is you have better infection control measures. Wear your mask, wear it properly, have ventilation, don't mingle with crowds, keep away from getting close to people you don't know, all those 3 C's that we need to avoid. That is pretty good. And sometimes the lateral flow device is giving you a false sense of all is well with a negative result when we know 40% of the times they're incorrect anyway.
So that's 40%. That means 60% it is correct. And children widely seen as super spreaders. They could easily spread the virus to people who are more vulnerable. So do you really think the scrapping of lateral flow tests within schools should happen?
Well, whilst it is sort of good, i.e. 60% of the times it gets it right, the 40% of the times it doesn't get it right, people are dropping their guard. And I know because I deal with this at schools every day. So it is a huge expense to achieve a small end. it is better to have a policy of really good infection control measures and treat everyone as potentially infected and infectious than to just say, I tested and I tested negative and therefore I have the green light to be at the school. It is difficult to really judge now that we are where we are, having already spent the money with the LFDs.
I was going to ask, the opening up of schools was all based on this testing system. A lot of money spent, a lot of effort into this. Do you think that was the wrong move?
Scientifically, yes. I think we are using an inaccurate test to work out that the schools are safe or not. That has always been the case, that the LFD is only picking up the obviously infected person. It doesn't pick up the mildly infected and infectious person. We know that, we've always known that, and many of my colleagues, including myself, have said we are using an inaccurate test to achieve an end. And by the way, if I may add, the Medicines Regulatory Body equivalent in the United States has slated the lateral flow devices and said they shouldn't be used like the way we are using them in the United Kingdom.
Okay, even more confidence in the government right there. Dr. Bharat Pankhania, really good talking to you. Thank you.
Thank you, Claudia.
Right, after the break, we are going to be looking ahead at the England-Scotland match. We are just